Okay, are we ready? Dr. Rao?
Yes, sir, I'm ready.
All right, good afternoon to everyone, and we welcome you to this National Internal Medicine Day and appreciation of St. George's University Alumni Association. We have a group of internists or doctors, some have subspecialty who have moved on. We will hear from them. You'll have an opportunity to maybe ask questions at the end or post it on chat. We're delighted that you've taken time out of your schedule to join us. We're excited about this. Many have worked extremely hard. Once again, let me welcome you to this. I'm also an alum. Of course, I certainly graduated, an alumnus from St. George's University, graduated in 1989. And it's great to have you here. We will have who is currently the Dean of the Alumni Association, who was formerly Dean of Students. And he is my hero, Dr. C.V. Rao. I'm going to have you go ahead and greet us, please.
Thank you, Mr. Chairman. Good afternoon to all. Greetings from Grenada. It's so nice to see all the names and bring back great memories. I wish to first of all thank Alumni Relations team headed by Mr. Bob Ehrlich, who is the Vice President, and the entire team in the IT department, which made it happen. The Zoom has become our normal now. And I really appreciate all the work you have put in to publicize, to put it together, and make it a reality. That's first thanks I want to convey. I just want to thank you all the physicians, alumni, who have joined us in the last 1.5 years, especially, or more, we have recognized what a great contribution you have made during the most difficult, unprecedented times of our lives. You have come out as heroes, frontline workers, healthcare workers, doctors, definitely. You have dedicated yourself selflessly to the plight of your patients, which brings me to memories of the past when we started the white coat. You all took a white coat oath and you put on a white coat. You thought, that's it, but the white coats are haunting you. They're following you everywhere you go. And I'm so happy that you are able to make a difference in your patient's life every day, every hour. And you show that kindness, care, and compassion, which was instilled in you as a student. So I'm very proud, and I want to tell you how proud I am of your achievements, of your futures, and most importantly, your own personal lives, which have transformed. And now you're doctors in the pillars of the community. That's what you are. And I'm really delighted. With that said, I would like to say that I declare this function officially open and invite you all to participate. We have wonderful co-chairs, all of whom are alumni. And there'll be a very live discussion. That's what I'm looking forward to, and I know you will enjoy it. Enjoy the session, have a great time, and all the best in your life. Stay safe, stay healthy, stay well. Thank you.
Thank you so much, Dr. Rao. We will get right into it. And once again, I am honored to be among a distinguished group of panelists who have major accomplishments in the field of medicine, as internal medicine. And one of our graduates, Dr. Michelle Friday, who is also not just an internist, but a cardiologist. We will have her go first. Dr. Friday, would you introduce yourself first? And then I'll ask you the question, and I know you were born in Grenada. What's the one thing you miss about Grenada?
And maybe just before Dr. Friday speaks, I know Dr. Matthias from the Alumni Association Board wanted to also welcome everyone.
Okay.
Let's let Dwight go ahead.
Okay, please do. Sorry about that.
Thanks so much.
Yes.
Thank you. Welcome, everyone. On behalf of the St. George's University School of Medicine Alumni Association Board of Trustees, I welcome you this afternoon as we have this conversation celebrating our internal medicine alumni. My name is Dwight Matthias. I'm an adult endocrinologist. This event today is to keep us connected, to share our experiences and discuss our journeys in different fields of medicine. In fact, we are here to celebrate and recognize our achievements. The Alumni Association has made many strides throughout the years. We meet bi-monthly to discuss alumni affairs and find ways to increase participation and to keep the ongoing connection of our graduates from SGU. Our president, Bruce Bernardo, class being on the forefront, orchestrating and encouraging the Board of Trustees to find ways of engagement. The Vice President of Alumni Affairs, Mr. Robert Ailing, kept us focused on the metrics of engagement and participation and did a remarkable job and should be commended highly. Most recently, Dr. Rao has been added to our rank as Dean of Alumni Affairs, the spirit of St. George's University. I will also like to recognize Mr. Brendan Lagrenade, Vice Provost for Institutional Advancement. He has been an integral part of the Alumni Association. The Board of Trustees are a diverse group of medical doctors in private practice, group practice, industry, and administration. We are at the tipping point to catapult this remarkable phase of our organization, utilizing all available platforms to engage our SGU graduates so that we can share our experiences through the global reach of SGU. Most recently, the Alumni Association brought together the alumni community to assist our fellow graduates in St. Vincent and most recently with the COVID-19 surge in Grenada. Your response was tremendous and a heartfelt thank you to you all. Our Alumni Association focuses on programs of engagement and the retention of our graduates. We ask you to get involved, to participate in activities, and advertise or even share your expertise through mentoring, also to share your journey. Please log on to the School of Medicine Alumni Association portal and be informed. Today, we recognize you and celebrate internal medicine. A stellar panel today who will take time to share their experiences. So once again, I welcome you all on behalf of the Board of Trustees of the Alumni Association. I turn it over to you, Dr. Bonaparte.
I just need to unmute. Thank you so much, Dr. Matthias. Appreciate you, my error, and I apologize for that. But once again, welcome. And I think it's important for us to hear some of the stories of these panelists. I'll share mine a little bit later on as well. But I will ask Dr. Michelle Friday to share hers. First, you can please introduce yourself, and I know you will look at it from different position, but what's the one thing you miss about Grenada at this particular time? If you can go ahead and introduce yourself, please.
Thank you very much. Thank you to Dr. Rao, Dr. Bonaparte, and Dr. Matthias, and everyone on the alumni board who has arranged this magnificent event to celebrate the alumni. I am Dr. Michelle Friday. I graduated in 1988. Right after graduating, I stayed in Grenada, the Grenada General Hospital, as a surgical resident. So I was an intern, a house officer, senior house officer. And after 3 years of working at the General Hospital in surgery, I wanted to do urology. And I knew that if I wanted to do an official residency or fellowship, I would actually need to leave Grenada. So my thought was I can just stay in Grenada and work there and, and I'll finish off my career there. But once I realized that I needed to have more under my belt to be fully trained as a urologist, then I decided to go to New Jersey, Seton Hall, St. Michael's Hospital, to do a transitional year. During that time, I thought, okay, well, I'll try to get into surgical program. And by my second year of internal medicine, I realized maybe surgery may be out of my reach at that point in time. And at that time, I was actually offered the chief resident year for that program in my third year. So, you know, cardiology was pretty heavy in that hospital. And I realized that cardiology had a lot of the procedures that I loved in surgery and in urology. So I stayed at St. Michael's for 3 years as a cardiology fellow after my chief resident year. And then I applied for a guidance scholarship, and my topic was telemedicine in third world countries, which helped me win a interventional cardiology spot at Johns Hopkins the following year. However, I was also awarded the interventional fellowship year at Albert Einstein at Beth Israel in Manhattan the same year. So at this point, I was 6 years plus into training. So I took the Manhattan position and finished from there. I was a foreign physician and so had to work in an underserved area for some time, so came to Kentucky. So, so my current position now is interventional cardiologist. I'm the director of the Women's Heart Program and founder of it, and I'm in Ashland, Kentucky. I realized that was a mouthful. So what do I miss most about Grenada? As you can imagine, life here has been very hectic for me. Managing, you know, a family, managing work, directorship, and all the other community projects that I'm involved in. So once I get off that plane in Grenada, and I know all of you would feel this, time slows down immediately. I can just feel all the stress wash away from me. And that's what I miss the most. The minute you land in Grenada, you feel as if all the stress of the fast-paced world has just melted off your shoulders. I really enjoy catching up with family and friends, obviously. I make a trip to the market, my first thing, to get all the mangoes and golden apples and all the tropical fruit that I don't have access to in the United States. I miss the town of St. George. It just has that exotic feel to it. I love looking at the water and just seeing yachts on the water. And I love taking a sailing trip up the Grenadines. That also is quite relaxing, and I miss that. And obviously the food goes without saying. So there's a lot of Grenada that is just, I miss a lot. I miss driving up to the north of the island and seeing the wild seas, the islands that are north of Grenada, and just feeling that I'm in another world where there's no stress, and I can relax and calm down and regroup for my next you know, once the vacation is over, I'm recharged by the time I leave Grenada. So I miss that feeling a lot.
Well, thank you so much for sharing, and I appreciate it. Let me at this time introduce all the panelists, and we'll take them individually as well. I'm a graduate of SGU, like it's stated, in 1989. Dr. Phillip Bonaparte from 2008. Dr. Dan Srow from 2008. Dr. Louis Misoki from 2016, and Dr. Yalda Safi, and of course, if I mispronounce your name, please forgive me, but in 2017. So that is the lineup we have, and we want each one to participate. I can go first, but as a host, as a moderator rather, I want to give everyone an opportunity, and I'll chip in later on. So I'm going to go down the list in that order, folks, that was sent. So I'm going to call at this time on Dr. Phillip Bonaparte. I know that it is please introduce yourself, you'll do that, but I will ask you to answer the question, how do you handle your work work-life balance. And I know it's challenging. If you can share a little bit on that, but will you unmute your mic and go ahead and share with us, please?
Yes, thank you so much, Dr. Bonaparte. So I'm Dr. Purvi Parikh. I graduated in 2008. And, I also chose the path of internal medicine after leaving Grenada, did clinical rotations in Brooklyn at New York Methodist Hospital. And I loved all of my rotations, but I really, really enjoyed internal medicine. I liked the detective work. We had some excellent preceptors, some of which are also SGU graduates like Dr. Anthony Sala. And they really made the field so attractive. And there was so many parts of the human body, everything, comes around internal medicine. You're really the detective, the diagnostician. So then after that, I did my intern year at Westchester Medical Center. And then I went and joined Dr. Sarao, who will tell you his story shortly, at the Cleveland Clinic, where I finished my internal medicine residency. And then I ended up further subspecializing in allergy and immunology at Albert Einstein's Montefiore Medical Center. And, it was just such a great experience. I trained with many St. George's grads along the way. And since then, I'm in a very busy private practice, but I'm also on faculty at NYU Langone Medical Center. And during this pandemic, I actually have become very involved in the COVID-19 vaccine trial. So, it was a proud moment because, I feel like we learned at SGU about giving back as physicians. And I felt this was the best way that I could give back at a time where, the world kind of needed us. So similar to many other SGU graduates, we were all thrown into kind of the front lines of the crisis. So between that and my practice, work-life balance is a challenge. And it's something I'm still learning, believe it or not, even though I'm over, a decade from graduating medical school, because as a physician, it is very easy to get consumed by your work. We spend so many years and hours training in residency and fellowship, and then you think it gets easier as an attending, but actually I found that it was more time consuming to be attending, albeit very rewarding. So it is something that we really need to learn as physicians and constantly work on. I personally, especially in the pandemic, I felt like I lost that balance. So I'm just now getting it back in the last few months. For me, spending time with family, especially my husband, who I met in Grenada at St. George's, spending time, relaxing, reading. I really enjoy traveling to unwind. I completely understand, what Dr. Friday was saying about going somewhere else and just feeling the stress off, but that has not been as possible during the pandemic. But then also just taking time to work on your own health, right? Because you know how they say, if you don't put your oxygen mask on first, you can't help others, right? In an emergency. So I've been trying to put my own oxygen mask on the last few weeks and months by getting back into my workout routine, eating healthy. All of these things I think help restore that balance. So you're not consumed by your work, yet you still have some time to relax, take care of yourself, enjoy with your friends and family.
Awesome. That is great. I'm going to ask your husband to go right ahead and to share a bit. Dan, if Dr. Dan Srao, if you can just go ahead and give us a little bit. And that's, I think, is a great story to have to both of you meet in Grenada at SGU. I think that is a great story. I think you owe the university basically. But can you share with us what directed you to choose your current specialty in internal medicine, as a foundation of your subspecialty?
Yes, definitely. And thank you for having me. So to comment on Dr. Parikh's comments, it's also very helpful to have an amazing husband to support her. So yes, we did meet early on in medical school in Grenada. This was shortly before Hurricane Ivan, but we remained in touch and very close. So we were able to do our clerkships together at mostly New York Methodist, but everything in Brooklyn. And our core group of friends is which to answer the first question about what I miss most about Grenada is just the congeniality and like how everyone from all different backgrounds comes together and then ends up becoming lifelong friends. So it's just such a great environment to meet people that you get to know so well, you end up having friends forever. So after, when we were doing our, to figure out what we're gonna do for residency, I was choosing between surgery and choosing between internal medicine. And I conferred with my wife, Purvi, here, and she said that I'm too much of, I like to solve puzzles. And by the time you get to surgery, a lot of the times the diagnosis has been made, the treatment plan has been made, and you kind of go in there and then you do the treatment. So she talked me into internal medicine for the puzzle solving aspects, but also for just the broad array of things you can do from it. So you can do the diagnoses, and we got to do some pretty complicated cases at Cleveland Clinic, so that was exciting, all the way to intervention, because now we have interventional cardiology, interventional nephrology, there's so many different things you can do. So it's a great combination, a hybrid, if you will, of those who like doing procedures and also those who like the intellectual process of figuring out what procedures or medicines need to be used. So I did my internal medicine at Cleveland Clinic and decided on Cardiology Fellowship, which I did at North Shore, LIJ. In New York, it's called Northwell now. That was an excellent program. Did cardiology and then also interventional cardiology and endovascular and structural all together. So with my current position right now is I'm an interventional cardiologist. I have a very busy private practice with multiple locations as well. I'm the director for Dignity Health, which is a large health system. I'm the director of structural heart for the Dignity Arizona East Valley, and the national chairman for Common Spirit, which is the biggest nonprofit health system. I'm the chairman of structural heart for that. That's about over 700 health centers, and we have about 123 hospitals that do structural heart procedures such as valves and closing holes in the heart and various other exciting new techniques. How I got into that was when we were actually, Purvi and I were doing our interview at Cleveland Clinic, and the lunch rounds where we eat, but then we also see a lecture at the same time, was a gentleman named Samir Kapadia, who was on the forefront of the TAVR technology, which is a percutaneous valve replacement technology. I immediately fell in love with that. I turned to Purvi, we were still in medical school, seeing where we were going to go for internship. And I said, that's what I'm going to do. And I'm very glad that that happened. I think it was serendipity. And it brought me to now being able to practice internal medicine, but also being able to do the most complex procedures and making a name for myself and staying quite busy at that. So that was my path to internal medicine, and ultimately my subspecialty, and then my super subspecialty.
Well, thank you so much again for sharing, and we appreciate that. And we will move on to the next panelist, Dr. Louis Misoki, who graduated in 2016. And I want you to, if you can deal with it, what is the biggest obstacle you that you pretty much that you face and have been able to overcome? If you can share from that, answer the question for us. Please introduce yourself at this time. Unmute your mic.
Sure. Thank you, Dr. Bonaparte, and everybody for including me in this panel. I guess I'll start off by saying I'm probably the baby of the group because I'm still in fellowship. But I'm originally from Nairobi, Kenya. I I graduated in SGU in 2016, as mentioned, and did my clinical rotations at that time in not too far from where some of our previous panelists said. I was in Elizabeth, New Jersey, at Trinitas Regional Medical Center, and I ended up matching there, doing my internal medicine, and then ended up deciding to go into infectious diseases. And I'm now in fellowship here at Case Western in Cleveland, Ohio. In regards to what was the most, I was hoping I didn't get this question actually, but there's been various challenges, I think across the way. One I would say one of the biggest hurdles, actually, I should know this, is the being a foreign grad and having to deal with visa issues, I think has been something that every step of the way has been a fight and a grapple, and even now as into my advanced training has still been something that that's been is a challenge, and it's not just me, it's everyone in my position too. And I think one way that I've been able to overcome that is by having being in institutions or facilities that accept diversity and once they figure out what you bring to the table, are able to work with you and help you overcome those stumbling blocks. And so, I think, to the point of what I really miss in SGU, I think when it comes down to it, it's that diversity. I remember first landing down in Grenada, thinking to myself, I don't know where I'm going. I could be the only Kenyan/Ugandan out there. They may not, and really, once I got there, I realized that, nobody was bothered where I was from. They had met someone already where I was from, and I just fit right in, and I loved that. And it was now more about who were you as an individual and what did you bring to the table. So hopefully that.
You can also do number 3. Who is it that inspired you on your journey? If you wanted that, is anyone who inspired you? I'll ask you to respond to that.
I guess the question asks for one, but it's hard to pick one person. But my father was a physician, so getting into internal medicine to begin with was because of him. He's an internist, and one thing I realized about him, he's one of those old school docs, and he never shied away from taking care of anyone with anything. By the time he was referring someone, he already knew what they had, even if it wasn't fully diagnosed. And that was because of the pride he took into doing the investigative work, and sometimes even treating them right up until the end when he realized he couldn't. And I think that left an impression, and it left an impression on me because, I knew that, particularly coming into the US system, the internist is really the gateway to the rest of medicine. And, I then later decided to go into infectious diseases, and that had a lot to do with growing up in Kenya, and particularly in seeing the HIV epidemic, progress and transition, and see how we were able to fight through social activism through that and improve, outcomes there. But then, I saw a different side of internal medicine as a student and as a resident when I was on the rounds and working with our infectious disease specialists. I saw a different side that I obviously hadn't had encounter with back home, and taking care of the bread and butter of infectious disease, but just being able to appreciate the role that an ID physician can have on the team, even if it's taking care of cellulitis or urinary tract infections, to the most esoteric things that we see sometimes, including things like COVID, of course. So I think a lot of my mentors came from in my internal medicine rotation. My clinic preceptor, they were all infectious disease physicians, and I don't think it was a mistake that I ended up doing it, because that's usually how it happens. It's the people you spend the most time with who affect where you're going.
Well, thank you so much again, and to all the panelists. We'll come back. I'll do another round, but let me introduce myself. My name is Dr. Phillip Bonaparte. I was born in Grenada. I came from humble beginnings. I'm the last of 11 children. My mom gave birth to 11 kids, and I'm the last. I grew up in several parts, but was born in Woodlands and went to what back then was Back Street and moved to St. George's Elementary School in the park, or we call it in Queens Park, and then went on to GBS's, Grenada Boys Secondary School. I was skipped early on, so I ended up in high school at a younger age than my peers, and I was maybe the third shortest kid in the class. So I was, they used to pick on me a lot, talking with bully, but they didn't realize I was younger than them. So I peaked a bit later on. I love the experience. If there's anyone listening to this program, thinking where they should do, or in terms of medical school, the experience in Grenada is rich. I ended up after St. George's, of course, well, to get into St. George's was a challenge. The person that inspired me and helped me tremendously is Dr. C.V. Rao. It so happened that one day I was thumbing a ride, and Dr. Rao was the rider on his motorcycle. And he stopped just before the fire station on the Cardiology, and I started to share. I like to talk, so I started to converse with him, and I shared with him my dream to become a physician. I didn't have the means, the know-how, and he invited me to come and sit at the back of the anatomy class. He's, of course, one of the professors for anatomy with Dr. Christensen and others, and Dr. Jordan. And they had an exam in maybe about a week or two. I didn't have the books, I didn't have access, and took it and did extremely well. The question was, could this young teenager survive in medical school? I know Dr. Michelle Friday went through something similar too, but that opened the door for us. And myself and two others were able to get in, and we excelled, especially in anatomy. And I knew anatomy very well. And to the point where I became a teacher assistant for gross anatomy, and I would take sometimes failing students who anatomy to them, maybe they did a BA and really didn't have much science background, was like another language, and just walk them through, and they will do exceptionally well later on. Long story short, the thing I love about Grenada is the hands-on from pretty much day one, how we do differential diagnosis. That's just something I love. And it has helped me tremendously in my medical life. Initially, I went to England, and I remember following Dr. Friday in Bath, and I spent most of my time there and some time in Bedford. But the British experience gave me a lot more hands-on to hone in on my skills of listening, working out a differential in your mind, and putting the emphasis on the history and on physical examination. I did also a 3-month rotation in vascular surgery, and believe you me, I was good at it, to the point where the surgeon literally gave me a position to do a house officer and to become a surgeon there. Surgery was my first pick, but my family was in New York, and I came back to the U.S. When I finished England. Went to St. Michael's. I did part of my externship there, and then started my internship and residency at Jersey City Medical Center with Dave and some other folks that were there. And we had a great time and did that. My intention was to do medicine for 1 year, and like a transition year, and then go on to surgery. But I fell in love with medicine. I also always loved medicine. I wanted to do surgery because of my knowledge of the human body and gross anatomy. Let me just share with you, I can give you many, many examples. I've done a lot of medical missions in countries all over the world, where I'm not intimidated to go to people's home. I still do house calls if I call upon to do so now today. I serve as the founder and chief medical officer for New Hope Health Center. It's a free, 100% free health clinic in the city of Trenton, the capital city of New Jersey. I've worked in New York. I've been licensed in New York. I gave that up some years ago, but also now licensed and practice in New Jersey, more of a semi-retired position. But I've worked in both, academic medicine as an attendant teaching residents and medical students, and also in the healthcare industry, in the insurance industry rather, as an officer of one of the Blues Plaid, Blue Cross Blue Shield of New Jersey, and also as the chief medical officer for many millions of lives. And that has been quite an experience. I also worked on the hospital side as a senior vice president for medical affairs for Robert Wood Johnson University Hospital in Hamilton. And when in 2001, the anthrax scare happened, not just scare, but literally people came down with anthrax. I served then as the chief medical officer for that hospital, and screen and prophylax about 1,500 people who were exposed to that post office, which was just a few miles from our hospital. Was pretty much on the ground, did a lot of work in terms of, forming a disaster emergency medical expert panel back in the day in 2001 and 2002. Worked, to try to improve healthcare overall. But the thing I love about medicine and internal medicine, as was stated, to put the puzzle together. Let me share with you one example. It was a snowy day. It was a lot of snow, and it was coming on real fast. And just after lunchtime, in our corporate office, I got a call that one of our employees was having difficulty breathing. And I took my stethoscope, and this is not in a clinical setting. This is where I'm doing, policy, overseeing quality of care for millions of people. And I went down to his office, and as I looked at this man, he was sitting up in his chair, quiet, comfortable, did not appear to be in distress at all. So I started asking questions, and he, he answered, but just short answers. And, I said, well, could I examine you? And I took my stethoscope, and I literally, believe in me, I still do. I percussed his chest and listened to his lungs. And I looked to him in the middle of a snowstorm. And I said, you know what? I believe you have a spontaneous pneumothorax. And for some people who are listening, what does that mean? If you're not clinical, because I was not hearing any air movement at all in a portion of his lungs. And when I explained to him what he had, he said, funny enough, I had something like that, but it was some years ago. He fit the criteria. He was tall, he was skinny, and I made a called the ambulance, told them, rode with him to the emergency room, and had him, x-rayed and chest tube in place in little or no time. The good thing is, when he talked to me afterwards, the first, pneumothorax he had, he was in the hospital for more than a week plus. In this particular case, because of swift action in the middle of a snowstorm, he was able to walk out of there in 2 days. They treated him the first day, the next day, the end of the next day, he was on his way home. And I say that to credit the work that we've had in Grenada. What I miss, like everyone said, the diversity. And it created an environment which you will not see in some of the other medical schools, in the United States or any other place, is that we work together. Of course, we were competing to see who would get the highest, but it was good competition. Folks shared. We had a lot in common. We hang out together. We did sandblast together. We had fun together. I remember occasions where when they had nowhere to go, I will organize a ride with, one of the local fishermen to take folks to an island. I remember going to Hog Island, catching fish, cooking, doing a pot right there. And we had so much fun just to take a break from studying. I want to encourage folks, if you're thinking of, or if you have anyone who is considering the medical career, please, 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 not just consider Grenada, but medicine, internal medicine is a great opportunity for you to use your skills and to make a difference. I've been to places like Cambodia, India, throughout West Africa, and throughout the Caribbean, helping people going into remote areas and being able to do the things that I do and make diagnoses because the foundation that is given is solid, it is sound, and I believe that it makes a huge difference. All right, at this time, I'm going to go right back to you, Michelle, and I know that we have the alumni from what we call Institute for Further Education, or IFE, have been very much involved in the COVID situation or surge in Grenada that started in August, not so long ago. And I know that you've helped tremendously there in terms of forming a group. I want you to talk a little bit about question number 7, and give the Alumni Association an opportunity and how they can also get involved and make a difference in Grenada. If you can take number 7, please, in the COVID crisis that we just experienced in Grenada. Go ahead, please.
Just unmuting. Thank you so much. Philip, your story is, amazing. And I think it's really encouraging to hear your journey, which has been quite complex, and you've done quite a lot. So thank you for sharing that with us. In terms of Grenada, I am part of the Institute of Further Education alumni group. And for some time, once we started seeing cases rising in Grenada, we were kind of back and forth on the chat saying, well, we should probably start a fund. Number one, maybe we should also travel to Grenada and try to help. But at that point in time, there was a lot of talking going on. We were not really making a cohesive decision. So at that point in time, I thought we need to, just separate from the group, which was a group of physicians and, other people who have graduated from IFE. And Lisa Radix, who's also one of the physicians on that group, Bonaparte, and Dwight Matthias, who was on this call a little bit earlier. I think he's gone since then. We decided to kind of get together, form another WhatsApp chat, and put together a GoFundMe page. And we appreciate all of you who have, contributed to this. We were able to raise over $110,000. Our biggest concern right at the time when the pandemic broke was, 1, would there be enough PPE in Grenada? 2, what happens if the hospital is overwhelmed? They would need a lot of equipment that they are not prepared for. So a lot of the funding from the GoFundMe page, we got PPE into Grenada. We were able to also get some medications such as antibiotics, Levofed. In addition to that, we got equipment such as oxygen concentrators. We were concerned about the oxygen needs of the hospital because we were hearing in other islands that that oxygen was going to be an issue, the availability of it. So I know Lisa Radix worked with Brendan, who's on this call, the vice provost, and got together and immediately got in touch with the Massey company in Trinidad to ensure that there will be a continuing flow. So we've had a group of over 70 physicians who came together with a thought to educate the population about vaccination, since Grenada at that time, I think, was about 20% vaccinated, at least one shot. Now we're not quite at 30% yet. There's been a lot of pushback from social media on vaccination. A lot of people don't want to get vaccinated because of all the hype that's on social media. So we as a group have also tried to educate the population. We got Dr. Figueroa, who is a well-known Jamaican infectious disease professor, to have a Zoom call pretty much like this, where we had almost close to 200 physicians from the Grenada Medical Association, from Grenadian physicians working outside, and from the hospital personnel to just come on. And he spoke to them extensively about the need for vaccinating a population to try to reduce the wave currently and future waves for COVID. So we had quite an intense month and a half where a group of us were in touch with, the Grenada Medical Association. We were in touch with the personnel on the ground. We were in touch with the diaspora, just trying to get together equipment and supplies to send to Grenada. I know Dr. Bonaparte, who also, he was one of the first to go down to Grenada with a small team, boots on the ground to help the physicians on the ground because they were exhausted right up front. I think the 2 intensivists on the island got COVID. And so they had to be out for 14 days, just at the peak, the time when COVID was peaking in Grenada. St. George's has helped greatly. The physicians, Grenadian physicians who are outside of Grenada, St. George's alumni, we thank you all. Everyone came together. It was just amazing to see the teamwork that unfolded in that intense month and a half to 2 months to just try to stay and to flatten the curve in Grenada. So we're very grateful for all that transpired through then. We continue our work to try to possibly prepare for a second wave, but the biggest thing is education of the population to ensure that more people get vaccinated at this time. And we have some educational initiatives that are being started with some local artists to try to encourage people, give them knowledge, and hoping that they can get vaccinated through the knowledge of the science without forcing them to do that, but that they would be willing to take the vaccine. So it's been quite a couple of months, and we're grateful to everyone who has helped us with this. And this was all through the Grenada COVID Crisis Group, the alumni of St. George's, and Brendan, as well as the Grenadian personnel on the ground. So we thank everyone for that. And it's been great to talk about it.
Thank you so much, and I appreciate it. And just want to give anyone who has a question who is on Zoom, you can raise your hand or you can type it in the chat. Those of you on Facebook or any other the medium, you can just make us, just write it. If you have a question for any one of the panelists, you can go ahead and make it known at this time. Just so that you can understand it. And I think the beauty of having a network of folks speaks to the fact that in time of emergency, we're able to work, we're able to move. And so I want to encourage all of the alumni, if you graduated from SGU, no matter what field you're in, especially those in medicine, to please do everything in your power to join. And I believe you will certainly continue to make a difference in the life, not just of the people of Grenada, but I believe the world. All right. And is there any question? I'm waiting for direction. Anyone may have raised their hand. All right. Okay. We can certainly continue. Now, I understand that this is a challenge for me. When I graduated from my residency, I went into private practice, and there was very little, I would say, training on how to run a successful, practice. We've learned how to treat medical conditions, but very little preparation on the financial aspect of medicine. Any one of you can, if you want to share about that, how did that work for you in your particular setting? You can just, I wouldn't give it to anyone in particular. I'll leave it open. I wouldn't put anyone on the spot. But if you feel that you want to share on that aspect of it, so that folks who are in residency now or those who are about to graduate and they want to go into private practice. I know it's solo practice today is something of the past, pretty much. It's almost dinosaurs, but if there is anyone who learned lessons learned, if you can do that, you can go ahead and share that as well.
Yeah, I'll say something. Luckily I had my father, who's a physician in private practice, and I learned quite a bit from him. But one thing I would like to encourage all graduates, new graduates, people practicing, that, I think private practice is one of the best ways for physicians to take care of their patients. And the reason being is often in large corporate settings, the people that are making the decisions for your patients don't have any medical training, and this is a reason, one, we need more physicians in hospital administration, similar to what Dr. Bonaparte and others are doing, because we really understand what's best for our patients. And it is, you are able to run a successful hospital, corporation, health system, or even solo practice and still take care of your patients. I think, unfortunately, now there's been some brainwashing that the two are mutually exclusive. And I would argue, actually, you can take better care of your patients if you're the one that's making the administrative and financial decisions as well, because you will do what's in the best interest of your patient, not only the best interest of the bottom line. And that's what I learned. That's what I learned from my father. That's what I learned in the 7 years that I've been in private practice, that, I can actually make decisions that are best for the patient, and best for the practice. Whereas I see some of my friends who practice in settings where physicians are not calling the shots, and the opposite is happening, that patient care gets sacrificed for profit. So I actually think, and I'm stealing this from the CEO of the Cleveland Clinic, who is also a physician, Dr. Toby Cosgrove, I think it's a lot easier to teach a physician business than to teach a businessman medicine. So don't discredit, all the intelligence that all of you have as physicians. And that's just my 2 cents.
So I'd also like to second that. I think that there's a lot of misconceptions that I would say, especially it starts when you start doing your internship, residency, fellowship, that private practice is a dying breed or not a viable option. Absolutely untrue. There's always a need and a market for physicians, especially if you're exceptionally trained physicians, which we tend to have those who are coming from St. George's for all the reasons that Dr. Bonaparte mentioned in his amazing story in the snowstorm. So I had my father is a cardiologist. He had a small practice, solo practice, which is difficult to do in interventional cardiology. So when I got in and joined him, we got very busy, and then we started kind of expanding in terms of locations and other physicians. And really, our policy is just that, having trained in some very corporate health systems such as Cleveland Clinic and then Northwell, and you learn their value of physicians versus people who come to work in private practice. Their value is looked at differently, that they're not a cog in the larger systemic wheel. They're more so an asset and a position of respect. And so it comes with more autonomy. And honestly, it's financially, it's more than viable, it's beneficial. Because no one pays you to do an employed position unless they're making money off of you. So you're going to work very, very hard, and then for all of your efforts, you're probably going to see like half of what you would if you were working for yourself or if you're in partnership with a private practice model. The other misconception I wanted to address is that for those people who go into academics, and a lot of us do, because in order to get these big positions, you have to do research and you have to do publications. And there's this thought that these two things, that either you choose an academic position and then you go down that route, or you do private practice and then that's tends to be better lifestyle and better money. But that's certainly not the case for me or Dr. Parikh, as we both do private practice, but we are parts of, like for myself, large national clinical trials. I'm involved in 2 major national trials as principal investigator. Purvi is involved in multiple trials. How many vaccine trials?
Yeah, so now I'm involved in 6 of the COVID vaccine trials, NIH sponsored, industry sponsored, academic sponsored. So our point is, don't put yourself in a box. As a physician, especially as an SGU graduate, there's so much you can do. And speaking to, even the COVID relief efforts in Grenada, I do a lot of public patient education and advocacy in the mainstream media as well. So NBC, CNBC, et cetera, which has been much more given all the misinformation with the pandemic. So SGU actually reached out to me and asked me to go on one of the big Grenadian radio stations to kind of clear up a lot of vaccine myths. And then I also went on, I think, with Mikey Live. He has a large following on social media in Grenada. So there's so many opportunities and so many ways that I think SGU students can get involved and give back. And as Dan said, you're not limited. So if you go into academics, it doesn't mean you still can't do private practice, or you still can't, help educate the community, like through the media or social media. There's just so many opportunities, and that's the best advice I would give, financially and professionally. Don't put yourself in a box.
Well, I want to thank each member of the panel for an outstanding job. I want to thank, of course, Dr. C.V. Rao, who is Dean of the SGU Alumni Affairs and who is certainly former Dean of Students. I want to thank those who work behind the scene. I don't want to leave any name out, but those are part of the alumni group that are doing a lot of the work in terms of reaching out, putting things together, putting the pieces together, all those who participated in the meetings leading up to this event. At this time, I want to say personally, thank you so much for sharing. Time goes by quickly when you're having fun. I want to acknowledge the Vice President of the Alumni Affairs, and Robert, also known as Bob Alig. At this time, I will turn over to you, and you will, I guess, wrap it up.
Absolutely. Thank you so much, Dr. Bonaparte. And it's impossible for me not to be inspired by this dialogue, this conversation. And I've had the luxury of being able to connect with the panelists over the last few weeks as we have planned this. And I'm just so incredibly indebted to all of you, obviously, particularly to you, Dr. Bonaparte, for being our MC, but also Dr. Friday, Dr. Parikh, Dr. Srao, and Dr. Misoki. It's just been amazing. And I think one of the best parts of my job is that even though I'm not an SGU alum, I get to spend a lot of time with SGU alum. And every time I do, I come away inspired and grateful. So you've all done a terrific job. And I also obviously want to thank my colleagues on the alumni relations team who have worked really hard to pull this off, including giving up part of their Sundays to make it all work, as well as our colleagues behind the scenes in IT and marketing and communications. I think one of the single best things that our alumni can do is help us to fly the SGU flag. And by that, I mean, help us to recruit prospective students, help us to communicate exactly what all of you are doing right now on the front lines. And obviously today we've been celebrating our internal medicine alumni, and we're going to be doing more of these events to celebrate all of our specialties, all of our alumni. And obviously our goal here is to build this virtual community, but also very, very soon, I hope we can get back to meeting in person and connecting and sharing more and more special stories of our experiences in Grenada and what makes SGU and our alumni community really special. So thank you all very much for participating. And ideally, we'll be doing more of this in person very, very soon. Have a great rest of your.
Thank you all. Now, I know we can close officially, but if there is anyone with a burning question or you have a question you want to ask, you can just go ahead and we can take one. I mean, if you want to unmute your mic or just raise your hand so we can identify you, that would be great.
I just have one comment, if I may, for advice for people sort of starting out in internal medicine. It's just to look around at the specialties and don't be too quick to just finish internal medicine and get into practice to make money. Look around you and see, what sort of specialties are needed and do the extra time. I know many of you would feel that, once you're not working, that life stops, but really it's a work-life balance. If you plan to go into specialization, at that point in time, you can just go in it for the long haul. Once you've specialized, then you can kind of slow back down to your pace of life. I know no one wants to be a resident or a fellow for life, but I think that the years go by, and at the other side of it, you will be happy. You'll be proud of yourself that you actually are in a specialty that's really needed. We have population that's growing older, and we have, an older population requiring more cardiologists, for instance. And then I think 16% of cardiologists are females, and yet you have a 50-50 split on cardiologists. And interventional cardiologists, I think it's even less, maybe 5-6% of interventional cardiologists are women. And again, you have an aging population that's 50-50 women. So I think look around and see what's needed and try to go for the long haul in your internal medicine quest.
Sure. Thank you so much again, Dr. Friday. We'll take the last comment from Dr. Rao. Go ahead, Dr. Rao.
Thank you, Dr. Bonaparte and everyone. Yeah, I just want to bring up a special request to all of you alumni who are in this session, and you can spread the word. Grenada has gone through a major crisis in the last 18 months. People's lives have been changed. Their livelihoods are gone. As the times are coming back to normal, somewhat normal, new normal, I appeal to you to make plans to come here to Grenada, stay in a hotel, stay in a guest house, spend a few bucks on the taxi drivers, eat some chicken rotis, buy some curried beers. You miss those things, and that will be a very symbiotic way to build back Grenada. And I'm making a special plea to all of you and your families. Bring your children. They need to know where Samir and Dan met. Purvi and Dan met on the campus. Bring your children and say, this is the spot I met your dad. That'll be very meaningful to them. So bring your families, children, and come and hang out. And if you come here, I'm here. We'll walk on the beach and have fun. Thank you very much.
Well, thank you, Dr. Rao, and it's been my pleasure to share this afternoon with all of you, the panelists, and of course, those from the alumni office, those of you who work behind the scene. Once again, thank you so much. All the folks who work the technical piece, the writing, the advertising, the promoting. Thanks again. And Bob, I want to thank you personally also for the outstanding job that you do, keeping us on track. I want to say to everyone, have a wonderful afternoon. Some of my friends also came on, and I want to thank you and appreciate you for taking time out of your busy schedule to join us. Have a good one. May God bless each and every one of you. Goodbye.
Thank you.
Take care.
Thanks.
Bye.
Bye-bye.
Bye.